Hello, good evening, everyone.
Hi, ma'am. Good evening.
Hi,
How are
good
you?
evening.
Divya
I'm
here.
good. Yes, I'm good. How are you?
Fine. Missing our sessions.
Hi, Rakina. Hi, Rakina. So I hope everyone is doing good. Hmm? And how's the preparation going on? Divya, Rakina. I can see
It's
Shaista is
nice.
here.
Just revising.
Dipti. Yeah, everything. So good to see you guys. Hi, Udita. Hi, Udita. So good to see you all. Hi, Shaista. How are you?
Fine, Alhamdulillah. How are you?
I'm good too, Alhamdulillah. Just missing you guys. We have finished our sessions, and sometimes, I really wish that we had those
You
sessions.
look fresh and great today.
Yeah, thank you. Thank you so much. Okay, that's good. So I hope you guys are almost, there. And I think the exam is starting very soon, right? So in the last few days, what you have to do is, I will be asking you, I will be, keeping it interactive. I will be asking you guys that, how do you think that you have to spend the last moment? Okay. So of course, it has to be, the very revision session. In fact, okay, you just have to revise your, the stuff, what you think you haven't done before. And, like I always say that, don't try new things just before the exam. If you haven't done anything before, so don't do it again. Okay, don't try to do it. And of course, the syllabus is kind of so huge. So we don't know that, what we can cover and what we cannot cover in such short span, in the last 5 to 6 days. So of course, you have to prioritize and you have to think of yourself now. This is the high time when you will think about yourself that, okay, I didn't revise this thing, I didn't revise this thing, so I have to do this thing. Okay. So we are going to talk about the strategies, how you are going to, spend your last, I must say 5 to 6 days. It's not more than that, of course. So, how you are going to, spend these 5 to 6 days. So I can see Pradnya is also here. Hi, Pradnya. How are you?
Hi, Dr. Zaib. I'm great. How are you?
Hi, I'm good too. Alhamdulillah. I'm good. I'm good. So good to have you here. Okay.
Great.
So
I'll be
Humaira.
here. Yeah.
Okay,
Be here
okay,
in the session.
fine. Humaira is here. Dipti is here.
Yes, hello. How are you, Dr. Zaib?
I'm good, Alhamdulillah. How are you, sweetheart?
I'm fine. I joined quite late. I think I have missed so much.
No, you haven't missed anything, in fact. Okay.
That's good.
So we haven't started yet. Okay. So I was just
Yeah.
waiting that few more candidates joining, and then we will start. So I will just session link for your friend. Okay. Divya, can you take it from our group? The course group. It
The
is there.
same link. Can I
Yeah,
share her? Yeah.
the same
Okay.
Zoom
I'll do
link.
that.
Do it. Call your friends, whoever want to have, the interactive session discussion that how you are going to spend your last 5 to 6 days. Okay.
Is it
So
open for all?
Yeah, it is open for all.
Okay.
Yes,
So I
yes,
can
yes. Okay.
with my friend
Yeah.
also.
Invite your friends, no problem. Invite your friends. Okay. Invite your friends and anybody, who wants some, the kind of tips or tricks or help, anything. So we will try to, help as much as possible. Okay. So I will ask you, Shaista, what you will
Yes.
do in last 5 to 6 days.
Actually, I have a problem because when my study partner, her exam is on 21.
Mm-hmm.
My exam is on 25.
Mm-hmm.
I won't have any partner for me. She will start, she told that self-study from Friday onward.
Mm-hmm. So
My
it is a
exam is
good thing.
good
It
thing.
is a good thing. Yes, it is a good thing. See, till 21st of this month, you are going to prepare with your friend, okay? And once she is done with her exam, don't try to, be kind of interactive with so many candidates who are done with their exams, okay? Because all the time they are going to share their session, their performance. So of course, that can also impact your performance, okay? This is my sincere suggestion to all of you. For the candidates, who are done with the exam, don't just try to repeat those questions, okay? Don't just try to ask, and don't just try to swarm and penetrate in every group there is. Please tell me station, please tell me stations. Don't do that. because this is high time for you only. So in last 4 days, Shaista, what you can do is that at least, you can just, focus on yourself. You can just revise, you can have a schedule for yourself for 4 days and for 3 days, in fact, and one day before exam. Nobody has to study because nothing goes in and nothing extra goes in at all as well. So what happens is that, by the end of your this much complete hassle and complete preparation, so there is no use that you will stuff your neurons with any other new stuff. So I don't think that, and even that doesn't make any difference. So for the 3 days, you can do is that you can revise your own. Okay, if you have made your own notes, own points, small points, and yes, another important thing, Shaista, I want to tell you. Please focus on everybody, not only Shaista, but all of you guys who are here with us. So please focus on structured discussion as well. These days, I'm taking mocks for few candidates. So I'm really finding this thing in which every candidate is kind of not preparing for the structured discussion. If it is structured, it is like haphazard from question number 1 to question number 4. In question number 4, they want to say, okay, I want to add in question number 1. See, what does it mean by structured discussion? It should be structured. Okay, that's what I have always told you guys, that structured means structured. And usually in structured vivas, what happens is that this is going to be a successive the question. This is not going to be one question from this part of the topic, one question from this part of the topic, of course. Okay, so this is going to be, first of all, for example, for the whole scenario, if they're asking you what is the diagnosis, so please just give diagnosis. Don't just try to manage the whole case in that first question. And if it is given that the examiner is going to ask you 4 or 5 questions, and usually if it is not written outside, so examiner will tell you himself or herself that I have 4 questions to ask, and you have to answer each and every question. You cannot go back to previous question if you have answered one. So please try to understand that thing, that for 4 questions you have to make up your mind that in next 10 minutes you are going to spend 2 minutes each or 2.5 minutes each for each question. So my question is, what is your diagnosis? And the candidate is talking about, from A to Z. This is not the way, how structured discussion goes. Okay, guys? So be extremely careful in this thing. Okay? So do try to
Dr.
revise
Zaib,
your
regarding that,
Uh-huh.
in the RCOG course, when we asked about that structured discussion, they said
Mhm.
it will depend on the examiner, and it's
That's what
not
I'm saying.
mandatory that they will tell how many questions are there.
That's what I'm saying. That it is
If they
successive
don't tell how
viva.
many
Yeah,
questions,
it is successive viva. Successive means, so at least they'll be asking. Okay, but most of the time, what I have seen myself. Okay, I have of course I'll be telling you from my own experience, Tipti. They usually say what I have seen. Okay, even in my exam as well. I have been through this exam twice. So you can imagine that I have faced for 28 sessions. Okay.
Dr. Zaib, can I add my points from my exam? Well, so I think you should just let the examiner guide you in specifically in
Exactly.
structured discussion. So if they're asking a question, stopping, just answer that. If they've told you these are your questions and you have to tell the whole thing, tell the whole thing. So basically there'll be 2 sets of examiners. One who will keep asking you questions one after the other, and there'll be few who will just wait for you to talk. So you gauge that and judge that, and then go ahead. You'll understand. Obviously, you'll get to know. So there's no way you
So
can
don't worry
prepare.
about it. Yeah,
They'll guide
don't
you.
worry about it. Yes,
Yeah.
exactly. Examiner will guide you. So just listen to examiner carefully, because by the time a candidate is entering into this part 3 exam, so of course everybody is well read, everybody is well prepared, and head is so full of the knowledge and everything. So really you want to just I mean, what I can say, that you just want to vomit out whatever you have studied so far. But listen to examiner. On the other hand, listen to role player. Once, if you are not a good listener, you cannot be a good candidate. Please mark my words. Okay, so even if it is not written outside that there are 3-4 questions, or even the examiner is not telling you how many questions, so please bear in mind that I may be facing 4, 5, or maximum 6 questions, but not more than that. It is hard that even if examiner will come with 5, 6, 7, 8, 9, 10 questions. No, for me, what I have seen so far, usually they ask about diagnosis, for example, or they will ask about, can you please summarize the case? and take me through the management plan. And it has happened with me. There is a very famous, the maternal medicine scenario, which everybody practices for the inflammatory bowel disease, if I'm not wrong. Okay. So in that, the examiner was like, summarize the case and take me through the management plan. And then he just kept quiet like this. He was just, staring at me. I was just, hoping that, he will ask me some question. So it means that, I have to summarize whatever was given outside. Then I have to take through the complete management plan. If somebody is asking you that take me through the management plan, so be extremely careful. Management mean antenatal, intrapartum, postnatal. Okay. So in OBS cases, usually it happens in OBS cases, of course. Okay. So please, whoever is, the going for exam in the last few days, please do revise your algorithms, okay, specifically from RCUD guidelines. Most important algorithms are, you all know PPH, APH, the collapse, shoulder dystocia. Collapse guideline should be on your tips, everybody. Please, please, please. Collapse guideline, collapse algorithm, it should be on your tips. All right. One shouldn't be having any second thoughts if somebody is asking you how you are going to manage a case. Okay. And please take me through, what are the causes? Can you please tell me what is going to be the the collapse management? So one should be very clear in the knowledge, because this is pure clinical knowledge. If you don't utter words according to the guidelines, of course, applied clinical knowledge is going to be not good in that case. I hope this thing is clear. So for the people who think that they can't study without their study buddies, it happens because we are sometimes we are very much used to yeah Udita, I will come to that. Okay, I will come to that, don't worry. So what happens is that yes, it is a kind of a habit, and sometimes it becomes addiction as well, because we all are very much dependent to our study partners at times. But yes, if you have got time, and if your study partner has had exam before you, so don't just be intimidated. And if she is coming, or if he is coming outside the the after exam and telling you that okay, I did this, I have done everything, and I have covered everything, so don't just be upset, and don't just compare yourself. Who knows what is going to be in your exam, and who knows what are the stations which are going to come for you. So of course, you need to be very careful. And if your friend is sincere enough, if your friend is good enough, he or she must, practice with you. But I don't know. I don't know the level of friendship and sincerity that, how far are you, in your friendship in terms of sincerity and goodwill and everything. So it all depends upon. If your friend is sincere enough, so she or he should be studying with you. He shouldn't be, or she shouldn't be leaving you in the last 3 days. This is my, the kind of understanding for a good study.
How long we should do practice means doing the stations, to study our own our own notes. What do you suggest? Because
yes,
if you stop practicing, you forget, in my opinion.
Sometimes it happens, Shaista. Sometimes it happens because this is a human habit that at times we get so intimidated by, if somebody is doing very good, so we feel low that okay, no, she or he is very good, I'm not that good candidate, and I cannot be that good candidate. That happens. So that's what I'm telling you, that at this level, almost each and every one of you is a good candidate. Trust me, because I personally myself feel that maybe you are lacking in sometimes in 1 or 2, 3 tiny things, but just focus on those things as well, because after passing part 2, after preparing this much for part 3, everybody is like kind of well read and well prepared, of course. Okay, so in the last 4 days, you can revise your own points. And if you have if your friend is the good enough, so she should be studying with you in the last 3 days as well. So at least just give you moral support that okay, Shasta, if you want to do any station, I'm right here, you can always call me, or you can always text me, so I will prepare with you. Okay, because you have exam after 3 or 4 days. Okay, so even if not, so don't worry, don't be upset. Okay, don't worry, don't be upset, and just stay calm, stay composed, and just try to revise with yourself in front of mirror. Okay, even what I did for myself was that because of the go-to meeting and Zoom, I used to practice with myself, I used to see myself, I used to record myself. Okay, then I used to watch that okay, because my habit is the moving of the hands, and my friend is here. He was asking me in the morning that, is it okay to move a lot of hand movements and this and that. So I was saying that we should be looking at a human, not a robot, in the exam as well, of course, and we have to be humans as well. So sometimes it is okay to move your hand if you want to really convey your message, and if you think that your body posture is there, but you shouldn't be sitting like the stiff candidates. These days, I'm taking mocks and it is on camera. So of course, I see plenty of candidates, and everybody has different nature. Everybody is different from one another. So sometimes what happens is, candidate is sitting so stiff. I'm asking, I'm being role player and examiner as well. So, and she's like, can I ask you, can you please tell me your name and date of birth? No expressions, only mask face. This is a clear, the kind of very low risk case. There is no, kind of bad element of breaking bad news or something in which you have to be like, so please stay normal in some cases. If you think that, this is not a case where you don't have to smile, but if you don't want to do, the complete smile, you can smile a little bit, half smile. Keep, your expression soft. You shouldn't be like sitting like this and asking like you have memorized something and you are just uttering your words. And another important thing, for the repeatedly asked station, so of course you know everything, you know what is going to come, but please be extremely careful. You never know what is going to be the agenda in same, what is going to be the task in same question which has been repeated, and which is coming as a repeat station. So be extremely careful, listen to the cues, and do respond to the role player. For example, in the labor ward scenario, somebody is saying that, I have my birth plan with me and I really want to discuss about that. I have thought, when and how, I'm going to deliver. And, I have been on internet and I've been seeing that, it's a good idea to have a labor plan, the delivery plan for myself. So I'm thinking that, I should be delivering at home and preferably vaginal birth. Okay, so please do acknowledge that. I see. Okay, that's very good of you that you care about yourself and you have made a delivery plan for yourself. So can you please tell me what are your thoughts about yourself, how you are going to deliver? So please acknowledge at the same time. Don't ignore, because I have seen candidates who are just listening and who are just ignoring the candidates. That of course the role player is giving you cue that I'm going to talk about my birth plan today, and preferably home birth and preferably vaginal birth. So it should be in your mind that, okay, after taking my the set history template, I will be asking and I will be going through the home birth pros and cons and vaginal birth pros and cons. If she is a the good candidate for both. If not, how I'm going to justify that you are not a good candidate? Okay, so please everyone take cues of the role players as well. Be extremely vigilant. Be a good listener in exam. If you're not a good listener, you cannot be a good candidate. I will repeat again, mark my words. Okay, okay, Shaista. So just repeat your own notes if you have made any. Just listen to the audios, or if you wish that you want to revise any any of the the module. If you, for example, you want to revise labor and delivery, so you can always open the recording and you can listen to, or you can fast forward and you can just listen to whatever station you want to. So this way you can revise yourself as well. Okay, and don't be low, don't lose confidence. Okay, and don't be upset that for the 4 days you are going to be alone. So it doesn't matter, it doesn't matter at all. Okay.
Dr. Zaib, lovely advice.
Can I ask
Okay.
you
Yes, why not?
Dr. Zaib, while during the exam, when the role player is on the screen, so do we tend to look at the role player or to the camera that is above the on the top of the laptop?
So laptop will take your the complete picture wherever, like at the moment I think you can see me, my books, my calendar, if I'm not wrong. Am I right?
Yeah.
So that's what is going to be an exam. So
Like
you
an
can
exam,
see.
yes, somebody is in front of us, we have to directly look at, because camera is up a little bit up. So
No,
I
no,
don't.
you can't do like this, right? My camera is up there, so I can't be looking at like this. It will look weird. Okay, so no, be natural. Just talk to her or him, whoever is in front of you. So it doesn't matter. Okay, be natural. and be polite, be soft, and look human, not robots. Everyone, please. Okay?
And
Mm-hmm.
I tend to frown when I concentrate on something written.
Mm-hmm.
I tend to frown, and I don't know how to control my natural frown.
Doesn't matter. Doesn't
Because
matter.
the examiner will know that
This is
she's
natural.
concentrating rather than she's
Even I
angry.
do. I do like this, sometimes.
I
You
thought
remember
of
me?
having I thought
No,
of
no,
having
no.
Botox before exam. But
Come on, don't spend that much money. You will have to do it again then. Don't worry about it. Be natural. Whoever you are, that is okay for you. Okay?
One pointer, Humaira, you don't have to worry about the frowning, because the 2-minute reading time, there's nobody there on the screen. It's just you're reading, and the screen goes away and becomes small, and then that's when the role players and the examiner come in. So it's fine if you make faces or do whatever. Nobody's going to be there that time.
Keep the instruction in frame.
Yes, I have a tendency to speak aloud, like reading a question. So maybe somebody is listening to me if I'm
No.
speaking aloud.
Nobody is going to listen to you.
Please read aloud. Actually, that's good, because you might miss out a few things if you're not reading out aloud. It's a very good habit. And keep typing things below wherever there's this space. Keep typing whatever you find important. You might not get to go back and see it, but it'll help you remember it. So,
Yeah. But it is good in online exam, but in on-site exam, this is very, the kind of bad, because, the next candidate will be sitting next to you. So in on-site exam, this is going to be bad, the physical. And guys, yes, I have a news that perhaps, in May exam, for the candidates who wants to sit for May exam, so May exam perhaps is going to be physical, especially for the UK candidates, okay? UK center, I mean to say. So this online thing is also going to go away, and inshallah, if COVID situation gets settled, so of course, we want normalization of everything. Apart from this, the online exam, because it is, in a way, it looks like, bad, but I think it is a blessing some way, because, you are in your home, your favorite environment, because this is my study room. I know here I sit, here I work. This is, everything is here. So of course, when I'll be in exam, I will be careful. And I have given online exam recently, European board. Okay. So, it has been very good experience for me myself. So, I think it's a good thing for all of you. So don't be upset about Osler. I think all of you guys have had Osler check with you today. I think you have got emails, right? So please check the system.
Doctor,
already filled.
Yes.
Okay.
System.
There
Great,
was,
great.
yes, I checked the Osler device check, and then there was a form, online form I just filled in and submitted. But I remember that somebody was saying that you have to sign it, print it out, sign it, and then send them again. I messaged them that do I need to send them again? They said no, as long as you have done.
No.
Yes. But today in the RCOG Osler guide, there was a session, I just heard it in the end, and they were saying, one lady was saying that you have to get it signed and then sign and then print, sign and then send it again. I really don't know, because they've already messaged me, though there is no need to send again as long as you have submitted online.
I think it is okay. What do you think, Pradnya?
I'm sorry, I missed that question. What was it?
The Osler system check and everything.
Yeah.
Confidentiality form. I signed the
confidentiality. Oh yeah, confidentiality.
You filled it, right?
Yeah, and submitted. And then they
Okay.
said, yes, thank you for sending the confidentiality form. But do I need to take a printout and sign it?
No. Absolutely not.
Okay. I think it's okay.
Not necessary.
Once online is done, it's enough, I think.
That's it.
Yes. That
You
much
don't need
confidentiality
anything
is enough.
except your passport, a hard copy. That's it. That's all that you'll need. Nothing else.
Yes.
Okay.
Yes.
Actually,
So don't worry,
Dr. Zaib, last time it was like they wanted us to sign, take a printout, sign and then send it. But this time they have completely made it online. So there's no confusion.
I remember. Yes. So Humair, I don't need to worry. Okay. So relax.
Yeah, there was only written submit, and we pressed that submit only, and it was, I think, submitted. Yeah.
It was okay. So once you have submitted it, it is okay, I think. Okay. No need to print out at all. Okay, great. Any other question? How you are going to behave in exam? My question to all of you.
Dr. Zaib.
Hi, Sarika.
How are you, doctor?
I'm good. I'm good. How are you?
Fine, good. Dr. Saif, regarding that for the reading time, nobody will see, or we everybody will be see on the screen?
No, nobody will see you, and only the team, Osler team, which is on the background, they can only watch you and they can only see you. Okay?
Because,
That's
yeah,
it.
because I am thinking our phase of reading is different.
No problem. Do it. Do it as you know, whatever face you want to make. Okay? Doesn't matter. This is your face, your exam. Do whatever you want to do.
But the result they will give.
Oh, of course. in 10 minutes scenario, that is going to decide what is going to be your result, but not the 2 minutes time, not your faces or anything.
Okay.
Okay, great.
Okay.
Great. So my question to all of you is how you are going to behave in exam.
So we
As a friendly
should be a
consultant,
nice dressing.
approachable consultant,
Very good. And
a structured candidate.
And safe practicing doctor.
Yeah.
Okay. You have to appear as a the safe practicing doctor, the doctor who is just one step ahead to work and to enter into that system which is entirely different from our system. So of course they really want us overseas candidate to be as the good as safe practicing doctor as possible. Okay. So don't miss out safety points as well. A safety check is very much important. It's like when we go out from our home, so we don't try to we don't try to forget some important stuff, our wallet, our car keys, for me glasses very much important, and I'm sure for so many candidates as well. So glasses, car keys, wallet, mobile. So at least the safety checks are there. If you forget anything which is very much necessary, so what will happen? So likewise in stations as well, the stations in which safety is a prime concern, so at least you have to fill that safety. You have to focus on that safety point, and whenever you see any station, always remember what is going to be the safety check over here, what is going to be the safety point. Like OHSS, there are some safety checks, right? Like the hyperemesis, there are some safety checks. All right. Like what else? There are some like sickle cell disease. If it is like kind of structured discussion, so of course they are going to ask you what you are going to give in the painful crisis. So of course there are some safety checks in terms of injections. And I said you cannot give to some the situation. OHSS, you are not going to give NHSS. This is a strong safety. You cannot give 5% dextrose to the hyperemesis gravidarum, the woman. And then you have to justify why I cannot give this. Okay. So remember, almost just keep in your mind that what exactly is going to be the safety point in every station, especially the recurring station, the stations which are based on green top guideline. Okay. So please be extremely careful when you study or when you read your in the last few days, you just quickly go through the algorithms or guidelines. Okay, summaries or whatever.
Dr. Zaib?
Yes.
Is there any particular dress code in which we have to present?
No.
Like in the physical exam?
No, sweetheart. Even in physical exam, there is no dress code as well. But I will suggest that wear nice, light colors. Okay. If you want to wear the hijab or something, so it should be like of nice colors, soft one. It shouldn't be bright red, orange, green, or something like which is coming which looks very bad. So at least personally I feel that the exam colors are for girls basically, that they wear the small, like I'm wearing this shirt, so you can wear this shirt, and collar is good because collar looks official. Okay. So if you want to wear the hijab or something, so extremely be careful that it doesn't interfere with your listening, because you are in online exam.
Okay.
Because
And we don't need to wear our like white coats or anything
come
like
on.
that.
No. Not at all. Not at all. Don't do that. Okay. Don't do that. Don't do that.
Doctors in NHS, they have stopped wearing coats since long time.
No, it's not like that. In physical exam, I have never seen myself, even myself and many candidates, because I have given exams in UK. So I've never seen anybody wearing the coat, white coat. So it is not a necessity. Personally, I feel that the blue, black, white, and soft pink, peach, and the gray. These colors are good for anybody. So you can wear simple. It shouldn't be very shiny. I mean, it should so look simple, sleek. That's it. For the boys, I think it's a good idea that please don't sit in t-shirt and don't just be in your the sleeping pajamas or something. It doesn't look nice at all. So at least look the official and professional.
Decent. Yeah.
For boys, yeah, decent. For boys, it is very much advisable that at least they do wear the full the puff sleeves should be in light colors, and if they wear tie, that looks very decent as well. Okay, but if it doesn't, if the tie because it is online and you will be sitting, so nobody is going to ask you that stand up and show me so but of course this part, this much part should be presentable. Okay.
Okay.
And yes, for the girls, don't wear so much makeup and the earrings. Okay, even if you really want to
Okay.
wear earrings, so it should be the small the earrings. Okay, so it shouldn't be like hanging one, so it doesn't look professional. So at all times, plus don't wear so many rings and bangles. It should be a nice watch. Okay, that's it. Nice watch in one hand, wherever you are comfortable. Likewise for the boys as well. There shouldn't be very cufflinks, the beautiful cufflinks. There shouldn't be any shining cufflinks, because perhaps in the lights there can be some kind of reflection, so it won't look good. Okay. Yes.
Hi,
Dr.
ma'am.
Zaib, in the sorry.
Uh-huh.
In the bereavement counseling, like
Uh-huh.
the IUD station or some bad news, if
Mm-hmm.
the role player starts crying, then do we offer like a glass of water or tissue or something like
How
that?
you will offer?
Because
How you will offer?
we are online, like we are not like in this
So
in
how are
front
you
of
going
the.
to mold? How are you going to mold your sentence in that?
Yeah, definitely. That's what I'm asking. Like in that scenario, we just stop saying anything. We don't do
No, no,
like
no,
we
no,
don't
no.
have
You
to
will
say anything.
say, I understand that you're very upset at the moment. Can you just have a glass of water if you have? Can you just have a tissue paper if it is with you? Just clean your eyes,
Okay.
clean your face, like this. You're not going to offer. And
Yeah,
another thing you
definitely,
offer,
definitely. Yeah.
because from online, how can I give something to somebody unless I'm in very virtual world, which
Mhm.
is these days it's in progress. So perhaps in coming 4 to 5 years, we are going to be in virtual world.
And also,
Uh,
Dr. Zip,
ma'am,
go through the
Metaverse.
examination, because that's why we are not saying I will examine you, because that seems very awful. That
Never,
how can you?
Humera. Yes, I always say, please, for God's sake, don't say I will examine
Because,
you in the presence of chaperone.
because even
Who's
if
going to give you?
we need, the examination findings are already given in the scenario. So that's the
And
main crux.
Humera, another thing, if you really need something to in terms of examination, so you just have to utter. For example, this is a preterm labor case. For example, this is a case of in which you really need information for the the further management. So in that case, you could say that for example, it is a OHSS case. So yes, you need some kind of information, examination findings, because you want to know that whether it is mild, moderate, or severe OHSS, of course. Okay. So in that case, you can say that I would like to, examine you in that case. If you will say, so perhaps examiner will give you findings. And that has happened with me once. I was in a course in UK. So, it was a preterm labor case. And, the examiner started asking me that, okay, this. Then when I said that I would like to know more about the woman, that, how much is she contracting at the moment? What's her per abdominal findings? Any scar tenderness at the moment. From the per vaginal exam, I would like to see that how far is she in her labor at the moment, her Bishop score. So then he passed a sheet to me, and it was written that okay, this. Then I said, okay, based on these the findings, I would like to go for my further management. When I said about the further management, I don't remember, I don't recall that session perfectly, but that has happened. When I said that I would like to do certain investigation, for example, I would like to do the full blood count. Particularly, I would like to see the baseline hemoglobin, baseline platelet count, baseline white cell count as well, because there can be any element of the acute infection as well. I might like to do the CRP, C-reactive protein because it is going to be elevated in any acute inflammatory reaction. I would like to have swabs done on her. If it hasn't been done earlier, I would like to have a scan at the moment, particularly if it is, for example, if it is early pregnancy. So of course you want to know the cervical length as well. Okay, so this happens. So when I said this, examiner passed the sheet, towards me. So I mean, in that cases in which, in terms of management, you really need, investigation or something. So of course you can, say in that case, but not in like, I mean, this is a bacterial vaginosis case. This is a clear-cut case sent by the GP. He has examined. He has done everything. Now you are telling that woman that, okay, I would like to examine you in the presence of chaperone, and I would like to put the speculum, which is the same speculum like, he has put in you to take the swab, and then, I would like to do the bimanual examination on you just to see that how your neck of the womb is, how your womb is, how your, the tubes and ovaries are. I don't think it is justifiable, and it doesn't look, nice either.
Ma'am, Udita here, ma'am. Ma'am, so in the same line, like when there's already a letter and where it's mentioned that the midwife has already seen and examined, so in that case also, like in the labor ward,
don't examine. Don't examine until and unless it is a labor case, for example, because labor findings can change any minute, any moment. Okay, so you can just ask in that case that, can you please tell me when midwife has examined you?
Okay.
So if she's telling you that she has just examined me, so of course you can't offer your examination. No.
Yes.
Plus justification is, according to the NICE intrapartum care, you have to do per-vaginal examination.
4 hours. Yeah.
4 hours.
Okay, ma'am. Right, ma'am. And ma'am, in the same line, like similar question to you and to Pradnya as well, because she just gave her exam. What about, explaining with the diagrams? Will it be legible? Because as being online, like in few cases, like maybe ectopic or
see,
better to avoid.
Me myself personally would never draw anything on humans. I'm not an artist. Okay, and this has been, taught to me the same, the course where I was in the UK. So the examiner, that was, the Dr. Sue, and she is like, I mean, now the head of all examiners. I mean, she gives, the teaching and training to all RCOG examiners. Okay, so she told me in that, the Viva, she said that, look, you can't draw human face. So if you are drawing, anything, like this, round body shape, so can, the role player might see, this is how my baby looks.
Yes, ma'am, you have mentioned this point before.
Remember, I have mentioned this point. Oh my God, is this my baby?
Okay. I mean, we don't know what to explain.
So this is my humble suggestion, that please don't draw humans, because we are not artists. We are merely doctors. We are merely struggling with our exams. So, we can't be, the artist as well, that, okay, we will draw a perfect baby and this and that. So of course it looks, bad. But yes, if it is a Myrina case, if it is like, I mean, you have to, just tell her that how to do the first speculum exam or pap smear, or, any, you want to take, the cervical sampling. So in that case, perhaps, you can draw that, you can draw, the womb face, you can draw, the neck of the womb, you can say this is neck of the womb and this is how we will put. So even, you can tell with the hand movements as well. So it's not me myself, I have never drawn any picture, even in the physical exams as well. So if you really are a person that you want to draw, so it's all up to you. But I will advise not to draw humans, please.
But Udita, where will you draw in an online exam? You have nothing in your hand. Everything is on the computer. And all you can do is type during the 2-minute reading time. There's nothing where you can draw. So there's no question of drawing anything. If it was an in-person physical exam, then you could have maybe thought of it. But now that question is not at all valid.
Exactly, because you have given the exam, you'll have better idea, right?
Right, because there's no place, no time also. It gets over so fast, right?
No time. Plus, in that small window, you cannot even draw this much big womb.
Correct.
So you will draw tiny things. It doesn't look nice. Okay.
Okay.
And please,
thank you.
I would sincerely suggest, please don't draw humans. For example, ectopic pregnancy, miscarriage, IUFT. So it doesn't look nice at all.
Yeah, better to play safe.
Yes, better to play safe.
Hello, Dr. Zaib.
Hi. Yes, please.
Ma'am, so
yes, I was.
Okay.
Yes, come again. Yes.
Ma'am, for the structured discussion, suppose like if we the question will be displayed, or will the examiner
Sometimes
frame.
what happens is that the questions are not displayed. For example, like we show you in our courses, so of course, because we really want you guys to look and listen. But sometimes examiners just ask. For example, me, when I was in exam, although it was a physical exam, so it was a maternal collapse viva, I still remember. So examiner was sitting like this, and she was just asking that you have entered into the labor ward and do blah blah blah. So what is going to be your immediate action? When I stopped, giving answer for this question, then she asked me what is going to be, the causes and blah blah blah. So it all depends upon.
Okay, we can say to the examiner that can you please repeat the question for me?
Yes, thank you. You can always do that. Okay, nobody is going to say anything to you. Okay, you can always say, sir, can you please, even if you don't understand after repeating, so you can even ask, sir or ma'am, can you please rephrase the question for me, please?
Okay, ma'am.
Nobody is going to say anything. Okay, so don't worry.
Okay, thank
you. Okay, my dear. Okay. Yes, Dr. Helmi.
Hello, Dr. Zaib, how are you?
Hi, I'm good, alhamdulillah.
So I was just attending today the live session made by the Royal College, I was just commenting on the issue of the drawing. They said the tasks are put in a way that they are not expecting any of us to draw anything,
Exactly.
That's one. And also regarding the examination, they said that, also the tasks will be put that there is no way for examination. And if so, you just say like you have to mimic that it's just like an online consultation. So you are going to tell the patient, if we are meeting face to face, I would like to examine you like that. So it's just I wanted to comment about it. Okay.
Very good. Thank you so much. Yes. We can always say that. And that's what, I think I have been discussing, and Divya, Rizwana, Shaista, they know that's what, I've been telling that, don't say, I will, and this is the set template for every candidate there is, and there is no harm in saying, but, what happens is that, of course, it is going to, take your 1 minute, 30 seconds. So you're losing your time.
Yes, exactly.
So just try to, get hold on your station that, it should be in your hands that, how consultation should go, how you are going to see, look, my dear all, in 10 minutes, in every 10 minutes, you have to show yourself that, yes, I'm a good candidate. I know, how this station should be. If the patient comes in my, the chamber in real life, how am I going to behave with this patient? Okay. So again, you have to fight for every station. You don't have to be tired. I know it is a kind of tiring process. Even in the real exam, we were so tired, and Pradnya knows that even in online exam it is going to be tiring, because all the time this is stress, a lot of stress. Okay, so don't
it is extremely. 3 of my stations got because there was internet connection on their side, 3 of my stations were not happening. I could not see the role player. One of the stations I could not see the question. It was extremely tiring, but you have to keep your morale high and sail through it. Really, that's very important.
And another thing, if you think that for somehow you had internet glitch or they had internet glitch, you couldn't see, like Pradnya said, that that you didn't see question and you have wasted your 7 minutes or the 6 minutes, and you could not finish your station. So you can always request for rerun as well. I remember when I was an examiner back in in 2021. So we had few reruns because candidate really wanted to do rerun, because one candidate she didn't have the proper internet, or somehow it got disconnected. So she just had 3 minutes, so she couldn't perform. So we had to rerun her station again. Okay, so there is an option, and I think they might have told you that as well. So rerun is also an option. But again, it's not for those who have finished their 10 minutes and they want to just do it again. So it's not going to be, but in legit reason it can be done. Good. Any other question?
Dr.
Divya?
Dr.
Yes, Mera.
In most of the strategy videos, I've seen that the candidates usually say to the instructor discussions to the examiner, hello, just hello. They never mention that I'm Dr. So-and-so and I'm here to discuss. I have read the scenario and I'm ready for the discussion, because this strategy videos are made on their actually system. So I don't think so. Why we are usually saying I'm Dr. Humaira and I'm ready for the discussion. I've read the scenario.
And there is no harm if you say that. There's no
It's a
harm.
good
They're
gesture.
not
They
going to
can
say,
do
it
it.
is a good gesture. It is a, I'm entering into the cubicle and then I will sit still. Examiner will sit still. What will happen? He is expecting you to, say something, and you just enter into the room and see, on the other hand, even, I myself, I have done this, I have practiced it. I used to say, good morning, good afternoon, good evening, because my one exam was in the morning session, the second exam was in the afternoon. Okay, so I used to say that, hello, good afternoon, I'm one of the exam candidates and I'm ready for structured discussion. So one of the British examiner, he was very happy,
Yeah.
when I told him, he was very happy. He said, okay, right, good morning. So, I mean, there is no harm if you say that. But if you will just go in and you will just sit still, so examiner will sit still, so who is going to start the session and you are running off your time?
Yeah, but regarding the time, because we are not sure which examiner is sitting in which time zone. So saying good evening, I know that my examiner is in the evening.
Exam, your exam. If it is an afternoon shift, if it is in morning shift,
Yes,
according to that.
Okay.
Because you are working in a UK system, not, about for every examiner there is. Okay. I remember when I was examiner, so our shift was from Pakistan time 12:30 till 11 p.m. at night. Okay, because we were running, the circuits. We had, the 2 circuits to do, 14 station, 14 station. So of course, it was like, kind of tough for examiner, of course, but not for the candidate, because you just have to face through 68 minutes and then that's it. Okay.
So Dr. Zaib, we have to follow means UK time.
Yes, of course, sweetheart. You have to follow UK time. Okay.
Or another thing, you can just use something very neutral like hello or something like that. Usually they introduce and they start talking themselves, as soon as you enter, you say, hello, I'm Dr. Pradnya, and they'll be like, hi, how are you? It's a very, they take you through it, you don't have to learn and be like, you go and start saying things. It's like a normal conversation. When you meet somebody, you say hello, it's like that.
These are basic manners, I think, and I don't think there is any harm.
Skills.
Etiquettes and basic manners.
Definitely. So they'll take you, don't be so worried about how you'll introduce and all of that. Just be yourself and be confident and just go and say, whatever. And, I'm ready for my discussion. That's it. And they take you ahead, take you from there.
Exactly like this. Okay. So all the time, like I always say, be yourself, be natural. It means be natural, please. Don't be a robot in exam. You can, change your position. I mean, all the time, you don't need to sit stiff, you have to show some emotions as well. You have to show some, the expressions from your face, from your body tone, from your hand movement, from your, you can even sit like this. If you want to, counsel something, you can, be like this. Okay, can you please tell me more about it? Like, we do in real exam, isn't it? If we are breaking bad news to our, the patient, for example, this is my table, this is my chair, the patient is here. So of course, I do, talk to her like this. I know, I understand, this is not a good thing for you. So the same you have to do is, okay? Be natural.
Dr. Pradnya, Udita here. How many structured discussion stations did you have in your exam section?
I had 4, including 1 labor ward prioritization. The fact that you had so many questions about structured discussion, the last one that I had was acute kidney injury, right?
I remember she was so worried.
Yes, it was. I thought it was a horribly gone station, and I was really worried about it because the examiner kept saying, what next, what next, what next. I had covered acute kidney injury in the beginning, but he kept saying, what next, what next. And I think that was just the way it was told to the examiner to take out the station or carry out the station. So, they'll take you through it. Just be confident. The fact was, I kept thinking maybe it's not acute kidney injury, and I kept telling all the DDs possible. And he kept saying, what else, what else, what else. So, they'll take you through it. You be very relaxed, be very confident with your knowledge, be very confident, be very humble, and be very empathetic, and that's it. It's the rest of it is all your soft skills. That's it. You can't practice in everything and go, because that'll look very artificial. You be yourself and like how you would. Yeah, no, don't be like what Dr. Zaib is saying. Don't be like a robot. Just be yourself. How you would introduce yourself to a senior colleague. Be like that with in a structured discussion. I'm so sorry about the noise behind.
okay. You're cooking something.
Yes, something being cooked, yes. In the kitchen.
Okay,
Yes.
okay, fine. Any other question, guys? Okay, regarding TOG articles, I think Udita has asked. So in terms of TOG articles, uterine perforation, IBD, appendicitis, renal transplant, what else? Which TOG comes very oftenly? SLE you can do.
Spinal cord injury.
Yeah, spinal cord injury, hot
Injury.
favorite topic. Spinal cord injury. Then comes,
Epilepsy,
I
GTG
think,
and TOG. Both is in. Yeah.
sorry, which one?
Epilepsy, the epilepsy,
Oh yeah,
GTG and TOG
epilepsy,
article. Both
GTG and TOG
important.
article, both. That is a very hot favorite topic. Plus diabetes, insulin pump,
Yes.
DK.
Okay.
Okay, DK is important. Then comes hypertension. From hypertension, I think there is no TOG except aspirin and calcium. So that is pretty, the same from
Urodynamic.
urodynamic is important.
Extremely
Okay,
important.
urodynamic. And yes, in terms of urodynamics, do try to be as simple in your the conversation as possible. Okay, go through patient information leaflets for that. Okay, it is very much important. At least you should be well versed in overactive bladder, how you are going to talk about the diagnosis, stress incontinence, mixed urinary incontinence, how you are going to tell in the layman language. It is very much important. Okay, these three things are important in, I think, this urogynecology module. These three things comes quite often, and definitely there's going to be one station from urogynecology, isn't it? So please, do read patient information leaflet. Do just try to practice as the simple language as possible. Okay. Okay. Any other question?
Dr. Zaib, I have one last question.
Yes, please.
We know that during the pre-operative list discussing with the examiner, and we know in the consent process, we already tell the patient about the risks and the additional procedures. Like additional procedure, like if there is any injury to the organs, we have to repair it. Or if there is any procedure that we need to do, like if we find that the ovary is also necrosed while there is torsion, we have to remove the ovary. But sometimes I read one question, one station that stating that what would you do if you find flimsy adhesions in endometriosis or chronic we know that from the talk or from the knowledge that removing the flimsy adhesions doesn't make a lot of difference. Yes, but the vascular thick dense adhesions removal, dissecting them really makes patient relief of pain to some extent. So flimsy adhesions, do we remove, because this is not an additional procedure? This is not something they have already discussed, or even if we have discussed, we can say to the examiner that yes, if we have already discussed with the patient that if flimsy adhesions are found, we can remove it. So how to mention?
Are you talking about the laparoscopy station in which the woman is going for laparoscopy, diagnostic laparoscopy, and she is a case of endometriosis? Am I right?
And chronic pelvic pain. Yes, it is a pre-operative tiny list. It's one.
I know, and you have to prioritize that list, if I'm not wrong, right?
Yes.
So in that case, it all depends upon. I don't recall that if it is written that what type of adhesions are they.
It's
I just remembered. See, again, I will say that these are all recalled things, so you can't rely on the insufficient information. Okay, so if you really know that if you are well enough in your applied clinical knowledge, so you can talk about that. Okay, if you can justify that this is not going to do the good any the difference in the outcome, so you can say that. Okay, if you are good enough in your applied clinical, as far as I know, in that station, in that particular station, there is no, I think, which I know there is, I mean, flimsy addition and the, I don't know, I don't remember. Okay, so if you think that it is not going to make any difference, you can say it to examiner, doesn't matter, because I think in that question it is written, it is being asked that what will you do if you find type 1 endometriosis. Okay, so you can say that we can do adenolysis. So of course if you are going for, because it is a the case of endometriosis, so of course you will do the endometriosis, because for the endometriosis, even if we are going for diagnostic laparoscopy, so we do ask in the consent. In chronic pelvic pain guideline, what is written that after excluding every causes although I mean it is not the recommended, because the 2/3 are going to be negative. But again, yet again, if it is specifically for endometriosis, so of course you will go for treatment of endometriosis, isn't it?
Yeah, it's for chronic pelvic pain and primary infertility. So I think we can remove the adhesions if they are very fine.
You can do, of course.
And in another, yes, in another question for right ovarian cystectomy, they say if you find a solid cyst of 10 centimeter, definitely it's some unexpected finding. So we are not going to do it, and we'll close the patient, and then we'll tell her that in the next appointment.
As far as I know, it is written in the consent guidelines that we don't have to touch any ovary for anything without prior consent, because ovaries are something vital organs for every woman there is. Okay, so as far as I know, so I think we shouldn't be doing that. So we can just say, just to keep ourselves safe, is that although I have this incidental finding on operation, but since I don't have prior the consent, so then in that case I will have the immediate consultation or immediate input from my consultant, and then then we can leave it as such, and then we can reschedule later on. Because I think personally, because it happens in our countries that we take consent from the siblings or the whoever is the next of the kin or something. But over there in NHS, of course, if the the patient is not giving consent, it is not consent until unless there is any kind of any mental capacity involved, or if there is any kind of the thing in which there is nobody and you just have to do it in the the best management of the patient itself. Okay. Any question?
Hello, ma'am. This is Rakina here.
Yes.
Ma'am, what kind of questions comes from ARCP, ma'am? ARCP, like
ARCP. Who is going to ask you ARCP, and why is going to ask you ARCP? It is an appraisal that happens almost every 3 to 4 years.
So no need to know about that, right, ma'am? ARCP and things.
Why? Are you done with your next of the syllabus?
No, ma'am. Just wanted to learn about it. And ma'am, regarding insulin pump that you have just said, like what kind of thing like we see to concentrate on for insulin pump, ma'am?
Insulin pump, for example, we are talking about diabetes. So of course, if somebody is on insulin pump and she's in labor at the moment, and so of course we are not going to, according to TOG article, you don't have to change the insulin pump. You don't have to touch the insulin pump. Leave it as such. Just monitor the patient in the lines of the labor monitoring. That's it. Okay. So the labor is going to be same. There is no change in insulin pump, of course. Okay. Because if the patient is stable, if the patient is something, so no, I don't think they are going to ask. OSAT, there is no question on OSAT as well. I will come to that as well. Wait. What else, Rakina?
Okay, just in me, ma'am. So in this, don't change. As you said, not to change the insulin pump, ma'am. So the patient will be just been hourly blood sugar monitoring in case of labor, right, ma'am?
Yes.
That's
like
the thing.
like the labor monitoring, of course.
Okay,
and you will have the immediate input from the diabetologist. You will keep him in loop, and of course you are just going to check the the sugars, and you are just going to monitor the sugar, the labor as it is like a planned. Okay.
And ma'am, and if the patient, normally if this kind of patient goes and have like going for operation, ma'am, so there is some question regarding that also, ma'am. If the patient is going for some operation and he has insulin pump, then what to do in that case, ma'am? The patient
it all depends upon where exactly the insulin pump is placed. Okay. If it is not on abdomen, so it is safe. Sometimes it is on thigh, upper thigh as well for I have seen one patient. Okay, so it all depends upon where it is placed. So I think again, it is not going to be in the pubic area.
Okay.
It is not going to be there. In the article, it is said that anterior abdominal wall. So it can be, this way, this side, this side, this side. So I don't think so it is going to hamper something. But if it is there, so at least, you have to be careful. That's it.
Okay, ma'am. This is some decay topic, no, ma'am? Decay talk. Which talk?
Yes. There is decay talk. Decay talk.
Okay.
Yes.
My final question, ma'am.
Yes,
like in the
please.
exam, during the exam period, like we will be doing in our computer, laptop. So we need to switch off, like sign out from all the Bivers and all the Telegram group, right, ma'am, in that period?
So if you think that notifications are appearing, for me, like I'm working at the moment, I'm in session, so my all notifications are off, okay, and I keep them off, because sometimes it will pop up a new email came, the new the food panda is coming, and new the sale is coming on, sale is going on, and now there is personal message from Telegram or something. So switch off all things, okay. Don't, if you can log out, so it's okay, but I think you can go in the setting and you can just turn off the notifications, so I think it will do.
Okay, thank you so much, ma'am.
Okay,
Ma'am, should we use a over ears headphone, or like the similar earphones that you're using? Can those be?
No, overhead, because it will lessen the surrounding noise as well, okay. For example, if you are in a room, there is a road, there is a lot of traffic, or for example, you are in a room, there is a lot of the birds around or something like that, so it will lessen that noise as well for you, because you can concentrate well.
Can those be wireless, ma'am, or it should be with the wire?
Yes, it can be wireless, doesn't matter.
Okay.
I use this because I'm comfortable, because I'm in session, but for my exam there is my professional one, and when I'm examiner I have that one, of course, and an exam candidate, of course, I had that as well.
But Shaista, by wireless ones, you mean the Bluetooth ones?
Yes, Udita here, yes.
Udita, okay.
No,
Udita,
no.
The Bluetooth ones, the battery will get over in a few hours, and this goes on, and you don't know how much time it will take. So best is to have something which you can plug in and use. And even if you're comfortable not using, like I didn't use any headphones because I used to not be able to hear my own voice. So I spoke normally without any headphones. So you can choose whatever is comfortable for you. Basically, being comfortable.
Normally in the sense directly with the microphone of the laptop or the. Okay.
Yes. Like I'm talking like that right now without any headphones, because I wanted to hear my own voice, to know if I'm talking, if I'm being too loud or being too whatever. So whatever is comfortable.
Voice, yes.
But there shouldn't be any echoing. For example, if you are in a very empty room and there is nothing around, no furniture, no books, no nothing, because the voice gets echo. So if there is a lot of echo, so of course you cannot. I think that it's better not to use.
Maybe Pradnya, will you? Wasn't your voice input any problem with that? Like your voice input examiners?
Did you do
No. I'm going to do today, so I wanted to know, which type of device should be used.
So I had a spare headphones with me on the table, and I did checking with both, and both were working fine. But during the exam, I chose not to use the headphones. I was just talking normally because this is more comfortable for me.
Correct.
Yeah. So you can do that. Use your headphones. If you're not comfortable, remove it. Basically, being yourself in that one day is, I think, the most important thing.
Because I have been used to open like this without using any headphones. So that's why I was wondering, because it puts a pressure on the ears as well. For a longer time, we'll have to keep it attached to the ears, and
But what my study partner used to do was, because she wanted to use headphones throughout the time we were practicing, she was doing it with her headphones on. She always practiced with headphones so as to get comfortable with it.
Right.
Yeah. So that was, she was very particular that I want to use the headphones. So throughout the time that we practiced, she used to be like, 1 second, give me a minute and I'll put on my headphones, and then she would start. So being comfortable, whatever works for you.
Basically. Yeah, that's comfortable. In those 3 hours, you have to be yourself. You have to be comfortable. I mean, you have to feel nice. You have to look nice. So that's it. Okay. There shouldn't be anything extra.
My question
I have a doubt. If the insulin pump is in the abdomen, should we change the insulin pump location, ma'am?
Sweetheart, where is the insulin pump location?
If she goes for cesarean delivery.
So my question is it in the lower abdomen? I don't think in the center. I have never seen. I have seen in the here in the iliac fossa most of the time, or in the hypochondrium, right hypochondrium, left hypochondrium, most of the time, what I have seen myself. But I don't know exactly.
If at all it's in the iliac fossa, then we'll be painting, no, madam. So will that be a problem?
No, there not be any problem. You will be extremely careful with your incision. That's it. And insulin pump this much. It's not like a pump, like pump.
Like the patient is not pregnant, but she is diabetic, and we have to do some elective gynecological surgery. So we should put the woman on sliding scale of insulin or continue the readings by this insulin pump.
In that case, you are not particularly well versed with the ward. So in that case, be safe. You can say that, I would have a liaison with the diabetologist, and then we will do the pre-op, the check according to the ward protocol. That's it.
Okay.
If you don't know anything, please don't pour in your, the knowledge into everything. You can just be safe, and you can say that, if you don't know anything in terms of the guideline or anything, if nothing is given, so you can say that I will manage this in the lines of ward protocol. That's it.
Okay.
Hello, ma'am. Snigdha here.
Hi, Snigdha. How are you?
Hello, ma'am. Fine, ma'am. How are you, ma'am?
I'm good too.
Ma'am, a question from my side. If there is a question on labor ward prioritization, ma'am, what will you suggest, whether to go from room number 1 to room number 15? Because last time someone said there were 15 rooms and that was difficult. And so going from labor room number 1 to room number 15, or prioritizing and then saying that which room is urgent and then semi-urgent and non-urgent.
For this, what I practiced and what I usually say, that I will have an aerial view of the labor ward. Aerial view. In aerial view, what you do? You will just, look
see
that,
APH, PPH.
Exactly. You will just find out the emergencies, collapse.
Emergencies, right?
Or, the cord prolapse, APH, PPH, inversion. So that is going to be your immediate priority. Ectopic.
Right.
Ectopic, right? So this is going to be your immediate. Any life-threatening condition which is harming fetus in the pregnant, of course, or the mother. That is going to be your priority. And don't forget preeclampsia as well.
Right, ma'am. Yes, ma'am.
Okay.
So going from urgent to non-urgent is important.
See, what I see is that, if you are saying that, 15 to 16 case, I have a doubt on this thing, when
maybe
ma'am,
Dr. Pradnya will able to tell us, because someone was saying there were 15 rooms, but yes, ma'am, among those 15 rooms, 4 or 5 rooms were empty. They had, yes, ma'am, they had mentioned it.
Yes. So if 6 rooms are empty, so don't worry about that until and unless that, in that room, PPH is coming. In that room, the fetal distress is coming. In that room, cord prolapse is coming from the midwifery-led unit. So it all depends upon, then you will check that, what exactly the urgency or emergency is in that room, which is coming in few minutes or, the half an hour or so. So then you will prioritize accordingly that, meanwhile, I will be looking at all these patients. And if that patient arrives in room number 6, which is cord prolapse, so I will immediately rush to that patient. Because I know that, if it is the cord prolapse, so we have to do the immediate category 1 cesarean section if there are any, the heart rate abnormalities. So we have to do it in 30 minutes. So I will immediately rush to that patient. Okay. Or meanwhile, if I'm managing another case, I will ask my ST2 or ST1 to go and fill the bladder. Okay. So, and I will ask him, so not to touch the cord, because I don't want to give any spasm to the cord as well, because it will aggravate the fetal heart rate abnormalities. Okay. So of course, so in labor ward, this is how you do. And I'm sure we all are practicing, whoever is practicing OBG. So what happens is that, that when you are in your labor ward, so of course, when you take a charge, so you ask, can you please tell me how many patients are in ward and what are the critical patients? So just tell me first, about those patients. So it all happens, it happens. Okay. So you can say that I will have an aerial view of the labor ward, and then I will go room to room. I will prioritize afterwards, after managing and after allocating the available staff according to their capabilities. And then I will prioritize. Then you can say, I will again reprioritize if I see that, another emergency case or any urgent case in the upcoming rooms. So there is no harm in that. Okay. You can always justify. If you justify yourself, you are good enough. Okay. Hello, sir. Hello, Dr. Hassan.
Good evening, Dr. Zaib. How are you?
Good evening. I'm good, Alhamdulillah. How are you?
I'm very
to
sorry
disturb you.
for being unable to join this very, very exciting session because, you know, I'm in another job. So,
Yes.
yeah,
And
yeah. So,
congratulations. One of your candidates has posted in group that she really enjoyed your session yesterday, one-to-one session. So
yes,
that
thank you.
is
Thank
very
you so
good.
much.
Yes, that is very
Yeah,
good.
yeah. We are working too hard in these days to cover everything regarding the exam. I hope all candidates here, all our friends in the room are discussing everything with you already. I know I'm late, but I cannot. Yeah, I cannot miss such important session to support all our friends and all our people who will appear in the exam. Dr. Bradley, how are you? I hope you are good as well.
Hello, sir. I'm sorry.
Yes, I know you and Dr. Zaib will mostly cover everything in a perfect way.
But we were missing you, of course.
I'm very sorry. I'm very sorry for
no, it's okay.
being late.
It's okay. I understand.
Yeah. So what I would like to say, just I know we need to finish the session. What I would like to say is, all of you, my friends, you are doctors, and you will keep doctors with or without the exam. So don't put too much burden on yourself before going inside the exam. This is only an evaluation. So you should be calm, confident, thinking in a proper way, and don't try to pretend your actions. Don't try to pretend that you are so much caring and you are blah, blah, blah. And no, don't do that. Don't try to be another person rather than you. You have to be natural and you have to be confident. Even if the station is difficult, it doesn't mean that you fail the station. And even the station is very easy, it doesn't mean that you pass the station.
Pass the station, exactly.
This is definitely, you know, Dr. Zaib, most difficult stations I passed through my life, I passed them. Easy stations, I failed them, by the way. Okay, because in the easy stations, competition is very difficult and examiner's expectation is so much high. So if you even miss tiny information, the examiner will give you borderline. While in difficult stations, if you didn't do any harm or a major mistake, you will gain pass. Okay, if you are a safe doctor, you will gain pass. So my advice, you should be very systematic in thinking. Systematic. I will ask about relevant questions, offer examination, offer some investigations, and discuss the plan of management. However, it's not my job to finalize the plan of management. So I will offer joint clinic, multidisciplinary team, a further appointment with my consultant, some leaflets or some informations, contacts, numbers, and I will offer another appointment. This is my job. This is my job. Your job as a trainee is to primary evaluation of the patient and managing the emergencies. So you should be fit in obstetric emergencies, cord prolapse, postpartum hemorrhage, antepartum hemorrhage, shoulder dystocia, no mistakes in emergencies. But in difficult situations, you only need to prepare a good counseling session and to act. Try to act properly. And please keep schemes in your mind as much as you can. It will save time, effort, and will be protective for you if you have a strange station. Okay, keep the schemes in your mind. For example, if you would like to discuss a post-operative care, for example, post-operative care, where should I transfer the patient? High dependence unit on the gynae ward, close observation for the vital signs, any needed further investigations, medications, I will offer thromboprophylaxis, antibiotics after exclusion of allergies and a liaison with microbiologists, some painkillers, and documentations. I will check fulfill the operative notes, incident report, risk management team, GP letter. Thank you so much. This is my scheme. It's very easy. It's very easy. I know nothing about anything. I have some schemes I will follow. Okay, this is my advice, and my advice in structured discussions. Remember 2 cornerstones: systematic approach, justification of everything. Don't tell me I will do full blood count, liver functions, kidney functions, and electrolytes. This means nothing for me. You should justify what is the cause of requesting full blood count. I need to do full blood count to exclude anemia and thrombocytopenia or for any bleeding tendency. Perfect. Now you will gain the maximum mark. In SPTs, don't get in depth in knowledge. Don't do that. You will open a door which is very difficult to be closed. When you are talking, Dr. Zaib, you are talking about, for example, Arnold-Chiari malformation. If you try to explain what is Arnold-Chiari malformation to the patient, yeah, the bridge between the 2 cerebellar bodies in the baby's brain will be absent and he will be ataxia like this. What is this? What are you doing? You will lose the station. The problem is, I'm afraid the scan showed that your baby is unhappy with some brain development errors. I'm very sorry for that. That's it. That's it. Yeah, that's it. Nice. Okay, believe me. I tried all these games. I went to the exam once, twice. So I tried all these games and I failed when I was so much sophisticated. Be simple. Okay, if you would like to discuss abnormal CTG, don't say to the woman, I am sorry, the CTG is showing deceleration and the heartbeat of the baby is upside down, and you know there is some problems in hypoxia. What is meant by hypoxia, doctor? I mean oxygen to the baby. What are you doing? The problem is, I'm sorry, I think your baby tracing is not good, your baby is unhappy, and we need to get your baby out as soon as possible. And finished, no more. So be simple, okay? Don't be sophisticated, doctor. And in SPTs, please, this is my last advice. I will go right now. This is my last advice. Explore very well any strange information. If the role player giving you strange information, you have to explore why. If the patient is, for example, asking for, I have a station like this. A patient is asking for assisted reproduction because she needs a baby. Okay. What about your relationship with your partner? I have no partner. People will do like this. Okay. You have no partner, so we have IOI with receiving donation, we have adoption, we have surrogacy. Perfect, thank you. You filled the station. Why? Because maybe she has no partner because she is unisexual, okay? She's maybe having psychological problems. She maybe had a history of child sexual abuse and she hates men. You will find something, clue behind why she has no partner, okay? So you need to explore the strange things. Try to find the clue by exploring the strange things. How can you do that? Sometimes the station may be straightforward, so you can exclude the main concern. Sometimes it could be difficult, so you have to ask open questions. and let the role player talk and talk. Okay? Ask open questions. It's not like, do you smoke? No. Alcohol drinking? No. All people, Dr. Zaib, are asking about recreational drugs. Recreational drugs.
I swear. Even
How
today,
come a patient 70 years?
Pardon me asking about the recreational drugs. And you know, she's being like very shy and she's just asking, why? Why are you doing this? I mean, this is not your fault.
You know, you have to ask it in a place. You know, a patient 70 years with a risk of ovarian cancer, okay? And she is dying, and you are asking about recreational drugs. What is this question? If I am the examiner in front of you, I will give you fail. It's unlogic question, okay? So you can ask recreational drugs to a high-risk group patient, 20 years patient with abnormal vaginal discharge coming to the gum clinic. She's at high risk. I can ask her about this. But for all people, this is unlogic, okay?
Exactly.
And this is my advice in SPTs. Try to be very logic. And the last thing, the examination is online. So there is no shame to play the game. Now, I'm concentrating with you. Head nodding, yeah. I listen you very well. Now, I am so empathetic. I'm very sorry for that. I can imagine how much this situation is. It's not like, I'm sorry.
Yes, exactly.
That you have a cancer results. I'm very sorry. So the next step will be, it's not like this. Where is the communication? It doesn't mean this is the exam is online. It doesn't mean that there is no communication. You can show a very good communication by leaning forward, coming back, facial expressions. Okay, head nodding. So you can do this. Don't miss these tiny things that may change dramatically your performance. Ooh, I'm so much talkative. Thank you so much. I have to go back again to cover.
Thank you so much for showing up. Thank you so much.
I wish all the best to all our friends, dearest friends who joined us for a long journey. Thank you so much for being with me, Dr. Zaib, of course, my senior, and Dr. Bradley as well. She's my dear friend. Thank you so much for joining us for all this time. And we all will wait for your success. You will call us one day very soon, and we will all celebrate together your success. Thank you so much.
Thank you so much, sir. Thank you so much.
Forgive me, I have to go. Thank you, my dear friends. Thank you so much. Best of luck.
Okay, that was a very heartwarming session. Yes, please.
FBS, I wanted to ask her, but then it's okay. I mean, sir had to go.
You tell me now. You are well read. You tell me how you are going to ask. How you are going to ask.
So I would say that as the baby is not looking very happy inside, and we might have to deliver the baby urgently. However, we also have an option where we can take the sample from the baby's. We can take a blood sample from the baby's scalp, and that can be tested for if there is, and that can give us an indication how much the baby is in trouble. And I know I'm not. That's what I wanted to know. Was that?
You know, let me tell you, sweetie, what happens in real exam is, I think it has never come in exam so far. I know 5 year registrations because of course I'm an old fellow now. So of course, I know 5 registrations almost. So far, I have never seen anything like that you have to explain FBS or something. Okay, seriously. At all, if you have to, explain it to someone that you can say that, look, Lucy, your baby is very unhappy inside, and what we have to do is that we just have to measure that what is making baby unhappy inside. Usually it is a kind of the lactic acid which accumulates, and that causes that baby to sleep more, and sometimes that we can pick from CTG, and that's what I can see at the moment. So just to confirm that what we have to do is that, we have to do, the sample, the baby's, the sample from the baby's skull. Okay, and that is going to be a very small, the sample kit. We are going to introduce, the speculum like you always had for, your smears. So, and through that, we are just going to take we are just going to give a very small nip on baby's scalp, and we are just going to take, because we don't have any other way to take the sample from the baby, because baby is still inside the womb. So we have to do that. So in that case, we are just going to take, the few drops from, the baby's skull, and we are just going to check, how much amount of the acid is there that is causing, this much, the baby is very unhappy inside, baby is sleeping, and, baby is not showing any, the movement inside. So, doctor, is it going to harm my baby? No, 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 Lucy, it is not going to harm at all. Okay. And at all times, we will be very careful, okay, in examining you. And if you allow, can I do that? Yes, 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 doctor, you can do. Udita, clear?
Cool, ma'am. Got it. I mean, okay. I was hoping whether we can just put it in one or, just 1.5 sentence. So anyhow, we have to explain.
No, no, no. 1 sentence, how you will explain? And usually, yes, if at all it comes, it can come as a teaching station in which you are teaching your junior that how to take the fetal blood sample. But, I'm afraid that it's not going to come in online exam, because we don't have tools, we don't have mannequins, we don't have anything, any instrumentary, nothing. But perhaps in physical exam, yes, it can come. Okay, then you are going to tell to your junior, see, David, what happens is that, we have to counsel the women in layman terminology, and then we are going to talk like this. Okay, so in that case, you have to say like this. Okay.
Okay. Thank you.
Okay, thank you so much, Iram. Thank you so much. Idea of taking this station was just to keep you guys little bit relaxed, because I know this is like, kind of very stressful situation. So at least you guys can smile a bit, and you guys can learn a bit as well in the last moment. So of course, if we are, successful in that, so of course it is good. It is good that at least, we are working on the right way. Thank you so much. Thank you so much. Yeah. And another thing I want to, address over here is, like Dr. Hassan said, that, if the station is long, and from your knowledge, and from your study that, okay, for example, this is a case of overactive bladder, and I know the management of overactive bladder is vast. It starts from lifestyle modification, it goes till urinary diversion. So I cannot speak, about all these things in 10 minutes. So what you have to do in that case is, either you can ask this way, which I prefer. I understand that you are having problem with the waterworks. So can you please tell me that, how far do you know about overactive bladder, and any treatment options do you know? Okay, no? Okay, fine. So we have got a couple of options, and we started from lifestyle modification, then medication, and if it fails, then we go for surgery. So do you want to know about all options, or just, some of the options? No, 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 doctor, I don't want to know anything about surgery. I'm just, so inside you will say, Alhamdulillah, Alhamdulillah, she's just interested in medical management. I don't have to go that far, because that is practically impossible to talk about each and every option. But again, you will explore. Can I just ask that, do you have any specific concern to talk in today's discussion? Yes, doctor, I have my birth plan with me, and I really want to discuss. That's very great. And I really appreciate that, you really, care about yourself, and you have thought about your birth plan. So do you want to discuss now, or, shall I, if you allow, can I ask you some question just to know more about you? Okay, fine, doctor. Okay. So you can just tell me now, so you can then explore. It doesn't matter. Then you will say, okay, just let me finish my template, and then I will come to the management. Don't do that. Likewise, in the Breaking Bad news station, in which somebody is here with the biopsy result, and she's just asking you again and again, I'm just concerned about my biopsy result, doctor. I don't know. And she's showing the expressions of anxiety as well, from her face, from her body language as well. I don't know, doctor, what exactly it is going to be. I'm really upset, and you are saying, yes, I will come to your biopsy result. Is it okay that if I ask you a couple of questions? Okay, then you will start like blah, 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 blah. And then again, like Dr. Hassan rightly mentioned that, do you smoke? No. Do you take alcohol? No, pardon me asking you that, do you take recreational drugs? If you really think that, recreational drugs can make any difference in the life, of the woman who is here for the discussion of biopsy, then perhaps, it can be a good question. But for me, I think this is not a good question at all. Until unless you see that, this is a case of HIV or this is a case of sexually shared infection. So of course, in that, you have to ask about each and everything. You have to ask about so many things in that case. But, and again, why are you signposting for anything? Why are you signposting? I think we have discussed it before as well. I think with our post candidate, but I will repeat again. Perhaps, it can be a taboo in your society, smoking. It can be a taboo in your society. Being sexually active at the age of 12, 13, it can be a taboo in your society or in our society, and usually it is, okay, because of one or other reason. But that is pretty normal at their end, okay. Even if you really think that you have to signpost, so in that case you can signpost. So if it is a case of stillbirth, then you can ask. I'm not saying that you cannot ask. Like Dr. Hassan said, 70 years old, ovarian carcinoma, and you are worried about the recreational drugs. Thank you.
Dr. Zaib, excuse me.
Yes, dear.
Dr. Zaib, as you said that if the role player is insisting to discuss about the report,
I'm coming to that.
And
give the report.
Okay.
Don't put psychological stress. Like I'm giving the answer right away. I'm not putting you on the stress.
Okay.
See, Dr. Zaib is ignoring me.
Oh, I know. No, I think you forgot to explain that thing.
Yes, I know you very well, Rizwana. I know you very well. You are a very keen observer. Okay, and I really appreciate that. And that should be, a good property. And it is a very good thing, in fact. I'm coming to, okay, let me come back to the, the Breaking Bad news. Okay, this is Breaking Bad news station. Candidates telling doctor, I'm very much upset. I really want to know that what exactly is in this scan. This is my first pregnancy, doctor, and I'm yes, I will come to this. And is it okay that if I ask you a couple of questions just to know more about you, and then I will come to the mutually agreed, safe, acceptable plan. The complete this much big, the lady is dying to know about the the miscarriage report. That is very much important for her, and I'm worried about my rectified the template which is fixed in my head. Okay, so then okay, is it okay? So what she will say that okay doctor, okay, so can you please tell me a bit more about yourself? Okay, this, okay, can you please tell me this, okay, that has happened. And in the middle she's again asking you, but doctor, I'm worried that what exactly is in the scan. Yes, I will come to that, Julie. Just let me finish my just few more questions, because I just have to finish my template because it is in my head. I just have to go with my template. Doesn't matter if somebody is dying in front of me. You don't have to put then psychological stress. You will break the news there and then. Okay, then you will say, okay, I understand, Julie, you are very much, the upset and you want to know about the report. So, I mean, this is your report. Okay. And the report shows that you are pregnant at the moment and, but blah, blah, blah. How you want to say about miscarriage or anything, then you will say. Okay. And if the person is asking again and again, 3 times, 2 times, 4 times, so please don't run after your set template. Just try to break the bad news there and then, and okay, then proceed with the consultation. Yes, Udita?
Yes, ma'am. So in this case, like as you said, will it be okay if we go with the most important question that could guide us towards
no, it all depends upon sweetheart. What I'm saying is that
rather than going a fixed template.
Exactly.
Okay.
Everybody go with the prefix template. There is must to talk about socio-economical history. How have you been feeling for the last 4 weeks? Have you ever been bothered, being low, depressed, in mood? Come on.
The things which are most important, which can lead us to the cause.
And another thing, Udita, another thing. And how about, is there any family history of concern? Come on, she is talking about miscarriage and you are talking about family history of concern. Then she will definitely say, what type of concern, doctor?
Yeah.
What type of concern? any
Maybe
history of blood clot, diabetes,
like,
or hypertension. So I mean, we can just imagine that, you know, in that stressful time, can somebody think, you know, about that thing? I'm afraid
ma'am,
not.
yes, maybe the post-mortem or the karyotype, if it has really revealed any genetic cause for the baby's stillbirth, in that case, we can ask if there's any family history of any genetic problems, because that could be something which can...
My dear, I'm not saying that, you know, you can't ask anything. Ask anything if you think that is relevant.
Okay.
Ask anything which you think can lead you in terms of management. Okay. Ask anything and then justify. I want to know about this because there are certain causes, you know, which are very much associated with genetic problems. So I mean, don't mind me asking that, you know, is there any genetic disease running in the family?
Yes. Okay, ma'am. Yeah.
So, I mean, regarding, you know, the blood clots, because this is also an important cause of the IUFT baby. So can you just tell me that, you know, is there any history of the blood clots running in the family? Because, you know, if it is, then it is, you know, going to give me a direction that, you know, I have to take you through that line of the management. Okay. So in that case, you know, you can say, and in terms of IUFT or any sensitive cases, of course, you know, where definitely it is a bad news. So don't, you know, over smile, extra smile, and don't be even, you know, the robot as well. You need to look human, for God's sake. Okay. Like Dr. Hassan said, you know, and literally it is happening. Literally it is happening every day. You know, me and Dr. Hassan, you know, we are, you know, sometimes, you know, we see, you know, the candidates doing this. Very stiff body, very stiff this. And do you smoke? Do you drink alcohol? Pardon me asking that. Do you do any recreational drugs? Okay. Now I will ask some personal question. How's your sexual life? If somebody is asking me, I would never say, I would never disclose my sexual life to anybody. There is, come on, okay? Nobody would, definitely. But what particular in sexual life you want to ask? So you need to be very gentle in your, you know, the sentence as well. So you can say that, you know, don't mind me asking that, you know, can I know that, you know, are you seeing somebody at the moment? Are you with someone at the moment? Okay, so she will tell you, or she will give you any hint. Please, sexual life is not a good word. If anybody who is using this, please don't do that. Come on. Okay, sexual life is, you know, a very big umbrella of something. Okay.
And Dr. Zaib, one question. If some question will come about the termination of pregnancy, like somebody is asking for the termination of pregnancy. One is on the medical grounds, and the other is like on demand. So, how will the scenario will come in this?
Sweetheart, explore the reasons in everything. I understand that you are here to discuss about the options of termination of pregnancy. Am I right, Julie? Yes. So, I mean, if you don't mind, I mean, can you just tell me that why do you want to go for termination? Is there any particular reason? Okay. So definitely she will tell you that, you know, yes, you know, I have this problem, I have medical condition, or I have, you know, another baby who is having Down syndrome and I cannot take care of my baby and blah, blah, blah. So in that case, I mean, you can talk about, in that case, then you will come and talk about, you know, the medical management and surgical management both. But again, you know, in all these cases, you have to explore. You have to explore. Okay. Okay, that's great. Any other question, guys? Yes, Rizwana? No question? No question is also a good question. It means everything is so clear and you guys are so ready to go for exam, isn't it? Yeah, that's great. So, Priyadarshini, is there any question? Chandana, you are here. Divya, Snigdha, any question? Udita? Okay, fine. Yes, of course, definitely. You all are in my prayers, and like I said in the study room as well, I'm really missing you guys. Okay, so I hope you guys do well. You have been an amazing candidates. Okay, so I can only say that, you know, all the very best to all of you. Again, I will say, repeat: be yourself, be natural, don't be robot, look like human, please, and be humans. Doesn't matter it is a, you know, the online exam, but still we are interacting with humans. We are not interacting with robots. Okay, until unless that in upcoming 5 years we see robots. Yes, yes, sweetheart.
Excuse me, Dr. Zaib, how are you doing? I'm fine.
I'm good, alhamdulillah.
Neela here.
Oh, Neela, your name has changed. Dr. Tech. I was thinking that there is someone with, the doctor, something. Hey, good to hear from you, sweetie. How are you?
I am fine. So I have a question, for the labor ward, sometimes to us, so many cases seem urgent, okay? So is it a rule that there will be actually only 2 urgent cases, or there can be more than 2 urgent cases?
Usually what I have seen and what I've come across of the labor board, because twice, in my examiner, the phase, I had 2 labor boards. Okay. So in almost, what I have, studied, and the key and the, the ancillary keys as well. So usually there are only 2 urgent cases, not more than that. They cannot give you, that much stress. They just want to know that, how you are going to deal with the urgent and the non-urgent cases.
For example,
yeah,
I will just give you an example, Dr. Zaib, because in one of the preparatory books, there is a case in which there is an undiagnosed breach. We are taking over at 8 a.m. Okay, and there was an undiagnosed breach that came at 7:30 a.m. and it was 4 centimeter dilatation and breaches at ischial spines. Okay, then on the same labor ward, there is a station multi-grab para 5 shifted from home. The baby having meconium, and she was shifted from midwifery led unit at 3 a.m. and now it's 5 a.m. and the woman has not delivered and the baby has meconium. Then there's another patient who is for trial of scar, and she was admitted at 3 a.m. She was 4 centimeter, and at 6 a.m. Fetal blood sampling was done, which was normal, and she was 6 centimeters. So that means the progress is good. Okay. So, and the last fetal blood sampling was also normal. And then we have a patient, 33 weeks with bleeding PV, doctor to see. Okay. But the CTG is normal. And then there is a twin IVF with first cephalic contracting. Okay. So, and there is a preeclampsia patient delivered in the first 24 hours. Delivery had to be done because of preeclampsia. So, here, like I see, like I say that undiagnosed breach is urgent. Okay, the woman who was shifted from home is urgent, and the trial of scar is urgent. So and the IVF is semi-urgent. So what to do?
No. Trial of scar is woman is doing fine. There is no tenderness. There is no tachycardia. There is no hematuria. So it means the trial of scar is cold case. It is semi-urgent. It is not going to be, the urgent. Urgent is going to be the woman who has been transferred from the home.
Okay.
Para 5, she is at risk of development of the, the PPH at any time. Okay. She is having meconium, and since 3 m, for, whoever is landing after 12 o'clock is not, the normal patient. Don't take that patient normal. Don't take that patient, the very cold case. Nobody will go, outside the home after like midnight. That is a rule, isn't it? So most of the time, until and unless, there are some habitual people like in our ward, we are in, the very extreme emergency, and people are coming that, we have been to a wedding. So we were coming, from the wedding. So we thought, let's go and talk to the woman, talk to the doctor about, I'm having this vaginal discharge. So since when are you having this vaginal discharge? So it's been like 1 week.
Yes, here in
Come
the
on,
night.
Here in our, yeah, India, Pakistan is same, I know. So there are no difference, okay? So we have had, until it is a habitual condition, but until unless, but this extreme situation, para 5, and she is having meconium, she landed at 3 o'clock, and since morning the baby is not delivered, and now she is pouring, the meconium. So of course, this is emergency. For me, it is going to be an emergency.
So what about undiagnosed breach?
Undiagnosed breach, if heart rate is okay, if it is high up, so I would like to know more about the undiagnosed breach. Is it, how about the contractions? How about the fetal heart? How about the bishop? How far is she in her labor at the moment? So I would be deciding on that.
Breach at spines.
Breach, it is still high. Zero is still high. So then you will see the contractions, number 1. Then second, you will see the heart rate. So if heart rate is abnormal, there is no urgency, patient is not contracting, she is just undiagnosed breach, so this is not emergency. You can deal it after, dealing with your, the first 2 cases. But if it is, having pathological CTG with undiagnosed weight, and so perhaps in that case, that can be urgent according to the cesarean section guideline. Yeah.
Thank you. So we stick to the rule of 2 then.
Yes, and again, I will say, Anila, that you have to be simple. First of all, just try to look for the simple things. Don't just try to look for abnormalities in everything. Okay, there can be some normal things as well in life, isn't it? So it's not always that there are going to be very bad cases all the time. But coming back to your question again, usually they do give only 2 urgent cases, 2 or 3 semi-urgent cases, and then the non-urgent cases. And these days they are giving that 4 to 5 rooms in which the patients are yet to arrive. So in that cases, you have to see that what are the the indications of arrival. If it is cord prolapse, emergency. If it is uterine rupture, emergency. If it is coming from midwifery-led unit, grade 3 meconium, yes, it can be emergency. But I will allocate one of my midwife or 2 of my midwife to just have a look at this. If I will ask them, inform me there and then when the cord prolapse woman arrives, because that is going to be emergency, my emergency. Then I will be going to that case as well. So you have to talk like this. Again, you shouldn't be very, the robotic in your sentences and everything. Change the priority. Nobody is going to, ask you that why did you change? 10 minutes are yours. In those 10 minutes, you can do whatever you want to do. You want to keep quiet, keep quiet. You want to speak. But it's very much advisable that don't speak nonsense. Okay, that if somebody is asking you that okay, for example, you have finished your structure discussion and still 2 to 3 minutes are left, and examiner are saying that do you want to add anything extra? Would you like to add something? So it's not always necessary that you will just try to add something. He's not giving you hint, because still you have 3 minutes. So he wants to ask you that if you want to add anything, for example, if you remember anything extra. But don't go back to your number 1 question, and then you will come back to, don't say many things that okay, I would like to add few things in my question number 1. I think personally that usually examiners don't like that. Okay, but if you want to add, that is your job. In 10 minutes you can do whatever you want to do. Okay, yes. Thank you so much, Pradnya. Okay, I will also
thank you, Dr. Zaib. Thanks a lot.
Okay.
Dr. Zaib?
Yes.
If it's a consent teaching station and we have to teach the junior for consent writing, like for anything, and specifically we don't remember many things, like infection is this much and risk of bleeding is this much. So in that case, we just need to mention that yes, in serious infections,
No. Even in consent, when you are taking consent from the woman, of course, at least you have to, be well versed in the serious, most common infection. Okay, that is important. Serious, that is very much important, and most common frequent occurring risk. So at least you have to say 2 to 3 things. Doesn't matter, you cannot memorize and you cannot even utter those all the words in exam. Humanly impossible. But at least if you are missing that laparoscopy, you are missing the vascular injury, you are missing the bowel injury, you are missing bladder injury. So yes, it is a sin. I won't forgive.
No, I'm talking in terms of I'm talking in terms of percentage, because we don't mention it to patients.
No.
For a junior, if a junior
we
wants
do
to
mention it to patients as well at times. Okay, we do.
Okay.
We do have to, in fact. Okay, if it is a for example, laparoscopy is very common station, cesarean section is very common, cesarean section placenta previa accreta is very common. Okay, and what else? Which yes, hysterectomy, that is common. At least you have to say 2 or 3 things that the serious complications, although they are very rare, but 2 out of 100 women can have the serious complication, and they are these. And the frequently occurring risk, the many women encounter some of these things that they can have some kind of pain at the scar side, they can have some the kind of numbness and blah blah blah, whatever you want to say.
Ma'am, any surprise station which can come? What do you think, ma'am, and how to deal with those?
I can come as an examiner as a surprise for you.
That will be very great.
But don't say hello, Dr. Zaib, how are you?
Yes, ma'am. How to deal with, ma'am, any surprise station which we don't have any idea? I mean, though we have points a lot of.
Yes. That is a very good question actually. So just go with the flow. ask the woman, how can I be of help to you? Can I know that, why have you come here today? Okay. And can you please tell me a bit more about yourself in your own words? Explore open-ended questions. So she will guide you what I want to know. Okay, what I want to say. Even if you don't know, anything. So of course, that is not going to be, at least say something. Stay safe. I will involve my consultant. I will involve the particular specialist. Okay. So at least some of the ABC, isn't it? I don't think that there is going to be any kind of 100% surprise session. But I mean, if at all there is, so just take it as it is, okay? And even if you haven't, given any applied clinical knowledge, so at least, you can score some of the, the 1 to 2, 3, 4 marks in your communication, because each station carry equal marks. So at least, and every number counts. And I know, how it feels to fail any, the exam by just 2%. And it does count. Okay, so fight for every station. Don't just give up if you think that there is any kind of surprise station which you have never practiced. Don't show it from your face that you don't know anything and you are here to just talk openly to the patient or anything. Okay. And yes, this is not unusual. I mean, of course, this is curriculum, and curriculum is so vast. College can give the question from any place, any module, whatever. So it shouldn't be like, kind of surprise at first place. Okay. That's so great, guys. I will leave you here. Yes. Okay.
Ma'am, so if there is a lay examiner, sorry, yeah, someone else is up.
Yeah. I asked you the question on termination of pregnancy as a few minutes back. In the in the termination, the medical grounds, we have to fill few forms, but as the patient demand for that, so in that case, we have to describe to fill the forms or what?
You have to follow, the same rules in everything. Termination of pregnancy, of course. Okay. And even if you don't remember at that time, then you can involve consultant, and you can always, say that I will look at the ward protocol, and then, I will come back to you. No problem. There is no harm. Play safe.
Okay. And previously we got the stations like physically when we do the exams, hysteroscopy and cystoscopy instruments. Up now, we don't get like these kind of stations.
See, I know 5-year stations, sweetheart. I myself have never seen laparoscopy, hysteroscopy comes in exam. It is a part of part 2. They give pictures and they do ask, perhaps some of the instruments, but not directly laparoscope, cystoscope, and that is, I think that is a viva question of our exam, FPS or IMM. Perhaps I have never seen in the RCOG curriculum. But if you are really that much keen to know, you can. But I will advise, better not to waste time on unnecessary stuff. Okay.
Ma'am, yeah, ma'am. So I was asking, like, suppose it is a lay examiner station, and that in the question, it's been in the case scenario, it's been mentioned that the patient or the couple has come to discuss the reports. In that, can we mention that? Can I know who is accompanying you, or should I just assume that is a partner? So
no, we don't have to assume anything. Okay, we can ask. We can ask.
Okay.
We can ask. There is no hard and fast rule. Okay, if you are not sure about that this is not the partner or this is not the husband who is accompanying, so you can ask.
Oh, okay.
So okay, if you see 2 people, so of course you will introduce both of them. You will say, hello, I'm Dr. Udita, one of the doctor in the antenatal care today. And are you Miss Julie Thompson? Yes. Oh, hello. And you can ask like this. Okay.
Even if you don't know. Directly, like the lay examiner might not be related to the patient, or is just sitting and.
Lay examiner, no. You cannot see. You cannot. It's better not to look at any examiner. Okay.
If in case it's written in the scenario.
No. Why are you going so deep, Rita?
Okay, so no need to mention.
तुम्हें लिमिट करना पड़ेगा मुझे, ठीक है ना? मानना पड़ेगा, सही है? Don't go in depth, all right? So there is nothing new in exams, my dear all. Okay, so stay confident, be yourself, be natural, don't be robot, and be very, the kind of smooth in your consultation, and go with the flow. Don't just go according to your own head, according to your own set templates. Okay, and if there is any at all, if there is any kind of station which you don't know at all, so in that case, you can just ask, you can involve the patient, you can take the information, and then you can bring back your background knowledge if you have any. Because by far, by in this exam, I don't think that any one of you is dumb, or any one of us is dumb. At least we know that what are the basic modules, what are the basic structures. So just stay confident, okay? And even if you can't concentrate on the station, so just concentrate on yourself. Don't look confused, don't be like, and don't do these type of expressions in front of examiner or patients, okay? Even if you don't know anything, you can simply smile a bit and you can say, "I'm sorry, I don't know about this question. Can I have next question, please?" Okay, if it is at all, if it is a role player and you don't know how to address the role player concern, so you can say that at the moment I'm not sure about how to address this concern. So what I will do is that I will discuss it with my consultant and we'll get back to you. Is that okay with you? Would that be okay with you? So I mean, you can simply rephrase or paraphrase yourself, but don't try to give the false information. And false information, yes, another thing, what every candidate does. I have checked your name and NHS number on the report, and I understand that this belongs to you. And there is no NHS number, there is no name on the report, there is only report. So what does it mean, Udita?
We have to ascertain whether the patient, whether the report belongs to the patient in question.
No, there is no name, there is no NHS number given on the report, there is only report.
We can ask the patient whether the reports which are included belongs to you. No.
Okay, you can. Okay, any other thoughts? Anyone?
It depends.
Do we have to comment about NHS number and?
Yes, sorry.
Ma'am, before disclosing the report to you, I need to check it whether it belongs to you or not.
Yes,
and
this is one
then
safety
I'll get
check,
back to
okay?
you.
But this is one safety check. For example, in the question it is given that patient is here to discuss the report of this is the report, okay? And of course, if in the question it is not given that and the only findings are there, okay? So in that case, how you are going to confirm the NHS? Or so I mean, you can just say that I can see from your case notes that you are here to discuss about your the report, biopsy report or something, okay? So then you can say, please don't lie at that time. It is a safety check, okay? But at that time, if you don't have any but in question it is given that this is the biopsy result, kindly see the patient, explain the biopsy result and come to the management. So in that case, you will just say that I have your biopsy report and I can see that this. But if there is report, for example, if there is a full report, and if you see in real exam, perhaps because in my exam there were 2 stations in which there were many reports, so we had to go through the all reports outside the the cubicle for 2 minutes. So of course it might happen in this exam as well. They can give you, so on that the reports, for example, this is full blood count report, for example, this is the liver function test report. So of course in that the number name is going to be given, NHS number will be there. So then you can say that I have checked your NHS number and the name, and this report is yours. My idea of asking this question is that, for example, if it is given in the question right away that the report findings are these, and now she is here to discuss about the management, just talk to her and take her through the management, okay? So then you are not going to say unnecessarily that I have confirmed your name and NHS number, because it is not given in there. So what it will show that you are lying, and because this is a set template of yours to talk this way. Okay, thank you so much everyone.
Ma'am, so what to do if there is no name and NHS number given, you didn't mention.
You are not getting the question. If it is already given in question, so of course you will take it as a question.
वो तो समझ में आया मैम. If there is a separate report without any name and NHS number, and in the scenario it's been mentioned that discuss the results. I'm saying when there is a separate report.
No, they are not stupid. They are not going to give you such sessions. No. They are not going to, do this much confusion. Okay.
So, ma'am, we will not say that word, okay, I have confirmed your name and NHS number. Is that what you are saying? If it is not written,
Did you confirm? Did you confirm? Is it written?
No, it's not written. So, I would not utter that sentence, what it is in our mind, like a stereotype.
I will never do that. For me, I have never done that, sweetheart. Okay. For me, I will never do that. Because I will just say that I have your report and it states this, 1, 2, 3. That's it. But if it is a real report, I have given you example. If it is a real report of biopsy, if it shown to you on the screen, and you will say the name given to you, the patient given you name that she is Evelyn, and the name on the report is some Julie. So of course, then you will say that I'm afraid, yeah, I have reports, but I'm afraid this doesn't belong to you. Okay. I'm afraid it doesn't belong to you. So what I have to do is that, I have to reconfirm with the laboratory and get your report first. Then perhaps, you might see the simple thing. Okay. So what I mean to say is that, if something is not given, so please don't lie. Don't lie. Examiner knows that, there is no NHS number, but everybody is so much, into this. I have checked your, and very sweetly and very politely, I have checked your name and NHS number, and I can see that this report belongs to you. Why? Lying very sweetly. Okay. So again, I will say that stay simple, be yourself.
Dr. Zaib.
Yes.
Regarding one question, if undiagnosed breach is coming 9 centimeter dilated, and then what we have to give option both or not?
9 centimeter dilated, sweetheart, again depends upon per abdominal and per vaginal findings. If it is 9 centimeter and buttocks are hanging in the vagina, so of course, you are going to deliver in that case. But still, you are going to tell her that if at all, we feel any kind of difficulty, so we are going to see that
we have to tell.
Yes.
Yeah, we have to tell risk and benefits.
But sweetie, first you have to confirm the findings of per abdominal and per vaginal exam. Okay.
Yeah.
So the labor management will depend upon per abdominal, per vaginal findings. Okay. So don't start your consultation without knowing that. Okay. हवा में किसी ने तीर नहीं चलाना, ठीक है? So you have to be very careful.
One more question. ये मुझे headphone से I have some problem.
Okay.
I cannot concentrate. So what should I do?
So if you have a laptop which has a very good speaker and very good the sound system, so you can use that. Okay. You can use that, but make sure. Okay.
So it's okay if I can speak on the speaker.
It's okay. But make sure your laptop is plugged in and make sure electricity backup is there, because in our country electricity is also a problem. So there should be a backup as well, and internet backup too. Okay.
So headphone is not mandatory, right?
No, it's not mandatory. But make sure that you are not in a very empty room where there is a lot of echo. So what will happen? That you will listen to your voice. Like me, myself, this is my study room. So I work here. So sometimes, if I'm using laptop, so there is no echo at all, because I have, so many books around, the 3 walls are covered with books. So of course, there is not that much echo. But if it is an empty room, if it is an empty place, okay, your OPD room, so that is going to be empty. So there is going to be a lot of echo. So be careful of that. Okay. Be careful.
Okay, doctor. Thank you.
Okay. So with this note, I will take leave and leave you guys to your preparation. Thank you so much for being so wonderful participants. Okay, not in this session, but also in courses as well, in our courses. So I wish you all the best. Okay, be yourself. This is what I will say. Okay, don't imitate. Don't just fake your accent. Don't just try to copy anybody. Be yourself. Okay. All right. Okay. Take good care of yourself, everybody. Okay. Yes, Sarika. Take good care of you as well. Okay. Okay. Thank you. Thank you. If somebody has any question, you guys can always reach out to me. Okay. I'm not a secret.
So much, Dr. Zaib. Thank you very much. It was really exciting session. Thank you.
Welcome, welcome, sweetheart. Okay. Okay, okay, guys. Bye-bye.
Bye.
Good night.